Mr. Chairman, dear colleagues, it's my pleasure to present today about POT data in the e-ULTIMASTER registry. This registry has been conducted in many countries. As you can see, a total number of 37,000 patients enrolled from October 2014 to June 2018. Just to remind you the situation of POT during this enrollment time, it was initially proposed by Olivier Darmon at EBC 2007. In the fifth consensus at EBC 2009, it was stated that the opinion remains divided as to whether this should be part of the standard approach, and we have to wait until 2016 to get this consensus. But should be considered a standard step in bifurcation treatment. The stent used in this registry was the e-ULTIMASTER. As you can see, it's a very well-known platform with specific features regarding the compatibility with bifurcation lesion, regarding the access to side branch, and capability for overexpansion in the proximal part. In this registry, 4,395 patients have been treated on bifurcation. The primary endpoint is target lesion failure at 1 year. All the clinical events have been adjudicated by the independent committee. The rate of clinical follow-up is good. And we here analyze the result by using POT versus no POT and kissing versus no kissing. In order to adjust the baseline characteristics and the lesion characteristics, and also the role of bifurcation technique, we perform a propensity match analysis. Very classical baseline characteristic for this group of patients. As you can see, it was mainly radial access registry, 12% of left main, 2 branches treated in 52%, and 2 branches stented in 24%. True bifurcation is 54%. The technique was, as said, mainly a single stenting. POT was used in 34%. Just to remind you the situation of POT at the time of enrollment in terms of recommendation. And kissing balloon was 36%. When two-stent technique was used, it was mainly T-stenting or TAP, followed by crush and culotte. POT is very beneficial, as you can see, no impact on cardiac death, but all other events have been reduced. TVMI, clinically driven TLR or TVR, and consequently the TLF is reduced from 6 to 4%, and there is also an impact on stent thrombosis reduction. If we consider the time domain, you can see that the divergence between these two curves occur very early and still continue along the time to 1 year. You can see that the benefit of POT is very consistent across the different subgroups, considering the location of the bifurcation, the diameters, the technique which is used to prepare or to post-dilate the stent, as well as the presence or absence of DPT at 1 year. When we analyze the predictive factors of 1 year TLF by multivariate logistic regression, we can see that POT is the only one regarding the technical approach, no effect of KBT. All other predictive factors are related to the clinical situation, the age, renal impairment, previous PCI, history of myocardial infarction, and the number of lesions. The story for KBT is a bit different, and we have 2 types of interaction. One is with DPT, meaning when you have DPT at 1 year, absence of KBT is related to a higher risk. And when you have a true bifurcation, the absence of KBT also is related to higher risk. Do we have any synergy between POT and KBT? It's not so clear. We have here a distribution of patients having POT and KBT, POT with no KBT, no POT and KBT on none of them. You can see that we have progressive increase in terms of target LMI on clinically driven TLR. We have significant values for the difference for these 2 points, and also a slight interaction with stent thrombosis. But of course, it's difficult to demonstrate this synergy considering the extremely low rate of events we have in the group of patients having POT and KBT. So to conclude, POT is clearly beneficial in all bifurcation lesions, whatever the stenting technique. KBT is definitely not a substitute for POT. There is no interaction between POT and KBT, but maybe there is a synergy. It's possible, but it's difficult to establish considering the low event rates we observe when we have performed both POT and kissing balloon technique. I thank you for your attention.